We're here at the Vienna Conference on AIDS with Gottfried Hirnschall, who is the director of the HIV department at the World Health Organization. And we're very pleased to have you. You just completed a press conference where we had a lot of evidence given, and I think we might want you to just give a general summary of that presentation.
Thank you. Thanks for having me. Here in Vienna, one of the important news that we are sharing is the number of people on treatment. 5.2 million people on a global scale are now on treatment, based on data at the end of 2009. This is an important increase, this is important progress, and this is very encouraging. We are at the same time here in Vienna also launching new treatment guidelines. Basically, science has shown that it is beneficial for the individual person, but also for the community, the population. It's better to start treatment early. What we mean by starting treatment early is we're looking at the cutoff, the CD4 cutoff point, and we are changing that from 200 to 350. Basically, we are lowering the bar so that more people get on treatment and people get on treatment earlier.
And how likely is it that we might implement this, and with whom, I guess would be the big question.
Well, when you say we as WHO...
who exactly?
Yeah,
who in the world, I guess is...
From a WHO perspective, who puts forward the guideline, we are working very closely with countries. Countries that are currently scaling up their treatment and prevention programs. Obviously, there are many countries in sub-Saharan Africa, but also in other parts of the world, in Asia, in Latin America, also in Eastern Europe. So we're working with a whole range of countries. Obviously, and that's another important theme of the conference here, is how do we balance the somewhat difficult resource situation at a moment of global crisis with increasing needs for dollars, for money. What is important in this conversation is to underline that these new treatment guidelines are also having an effect not only on the individual by staying healthier longer, having a better prospect of life, staying productive, being able to support his or her family better, but also that there will be, we anticipate a decrease in the number of new infections, what we call a prevention benefit. And that obviously will, on the medium and longer term, also have an important impact on costs. And we are anticipating cost savings by putting more people on treatment and putting them on treatment earlier.
So where is the next, what are the next challenges that you face within this process?
We are currently working with countries to look at their realities, to see what is the current situation in each of the countries. We are currently collecting what we call universal access indicators. We're working with countries to get this information. And based on this information and based on the current status within each country, we are assisting countries to review their guidelines, to review their national programs, and to make changes accordingly. Obviously, we are going to suggest to countries, we're actually pushing to sustain the commitments towards universal access. We didn't quite achieve it in some countries in 2010, as was the original hope, but we really want to put a strong argument to sustain the commitment towards 2015 and to use the new guidelines as a way to actually moving forward.
And we just interviewed Festus Mogai, president of a former president, and he is really committed to, I guess, bringing the countries on board from his perspective. Do you work with people like him and with other organizations to present a more united front when you approach a country and so forth, as far as trying to get them to make the right moves?
Well, we certainly, at the global level, work in a united front. You will have seen in this conference there's a very consistent message that's coming across, not only from the UN organizations, WHO, UNAIDS, UNICEF and others, but also from those who fund us. Gates just gave a press release, and the message is, yes, we may first of all, we need to sustain the commitment. Secondly, we may need more resources. But the third important message is we need to use the resources that we currently have more efficiently, and we need to find ways of saving costs wherever we can without compromising quality.
It seems to be a consistent message that to try to show that benefit of diligence on and efficiency to probably get a little more money, which is what you really do need. You need more money to make this all work.
Well, I think it is that we will need more money, but also with the money we have, we need to go a step further. And we think there is good reason to believe and to demonstrate that with a certain amount of money to get more people on treatment, you don't necessarily need the same amount that you needed for the first $5 million, 5 million people, excuse me. The gap is 10 million people. There's 15 million people that we anticipate will need access to treatment over the next couple of years. And we currently have 5 million on treatment, so there's a gap of 10 million. But we hope that we don't have to triple the costs that we currently have. But by saving efficiency, getting more, how do you say in the U.S., bang for the bucks.
Yeah. Are you working with some of the pharmaceutical companies about dropping prices and some of the generics and so forth?
WHO has been, together with partners, UNAIDS and others, has been quite instrumental in actually quite proactively negotiating price reductions very early in the ARV era, so to speak. And I think due to some of those negotiations and facilitating some of that dialogue, and together with others like the Clinton Foundation as a very important example, prices have dropped. For example, first-line drugs, as I'm sure you will be aware, have dropped by 99% from what they were 8 years ago, and they're really much cheaper now. Second line, there's still some room for negotiations. There's still some cost savings to be made there.
Are you happy with your new position here and excited about it?
I'm very excited about it. I think it is a time that allows for optimism, but it's also a time that really requires a careful look on how HIV and the whole issues surrounding HIV need to be sustained, but need to be somewhat brought into a broader health context, and where some of the programmatic linkages and the strong linkages with maternal health, reduction of maternal mortality, child health, reduction of child mortality, need to be really much more optimally made.
Clinton and others have mentioned about replicating good models. Have you? I'm sure you've looked at that. Is there anything that's jumped out at you as ways in which to implement almost anything?
Well, I think we have some very good examples, and that's one of the things that we see here in the conference, that some of the most heavily infected countries, specifically in sub-Saharan Africa, are making incredible progress. South Africa specifically, a country that has unfortunately denied access to life-saving treatment for too long, has turned it completely around and is really becoming a model in many ways.
Well, I very much appreciate you taking the time with me.
Thank you very much.
And you've been very helpful.
Thank you very much.
Thank you, sir.
Thanks.